Now I would like to make a few remarks. Your Excellency, when you gave me the responsibility to take charge of the ministry and ensure that we implement universal health coverage, let me disclose that for a minute, I felt a little bit inadequate, despite having the health background. But I want to thank you, because besides me as your advisor, you also have your advisors in the Economic Council. And the secret of our success today, Your Excellency, is that I sat with your advisors in the Economic Council, and I told them, you know very well, I am the advisor to the President. Therefore, we can only make a team. Your Excellency, Dr. Mwai has made great contribution. Your Excellency, Dr. Thuranira has made a big contribution. Your Excellency, Dr. Leah has made a big contribution. Those are members who are your advisors in the Economic Council, but I made them and turned them into my own advisors, and we have been working as a team to deliver on the responsibility that you gave us. Your Excellency, when we sat down and we agreed that for us to deliver universal health coverage, we must learn from the past mistakes and see what is it that we need to do as a ministry to ensure that this time round it does not fail as per your instructions. Your Excellency, we came up with 4 main pillars. The pillar on human resource for health. And we have been working together with all stakeholders. And today I'm happy to see that all stakeholders, or majority of them, are represented here. Dr. Davji, karibu sana, and let's work together. Your Excellency, we are in discussion, and in Kapkatet yesterday, we made a health workforce Kericho declaration. And one of the things that we agreed, Your Excellency, is that in the next 24 months, we are going to have a harmonious working relationship with all the unions, so that we ensure that we deliver on universal health coverage. We have many other issues or clauses in the declaration, and we have given ourselves timelines, because each one of them must be achieved. The second pillar of universal health coverage is on health commodity security. We have made tremendous efforts towards progressing that. While we began with ensuring that we reform Kenya Medical Supplies Authority, and I can confirm to you, the board that we have, the leadership that we have is now on track. And last week on Friday, you yourself witnessed what the team has been able to do. Your Excellency, when we came into office, the fill rate for orders that have been requested by the county governments was at 40%. As we speak today, Your Excellency, I have received feedback from many counties that we are now headed to 70%. And that is how we are working, Your Excellency. We are focusing on local manufacturing. We have brought all of them together, and we are working together to ensure that we achieve that you have given us to achieve. Your Excellency, the third pillar was on technology, that we ensure we leverage on technology to provide health care or health services to Kenyans. We have worked very hard. I must acknowledge that that was one of the most difficult pillars, but we have made a headway. That we now are sure that we are going to create a superhighway where all facilities can connect into and be able to provide services. But Your Excellency, the most important bit about the digital bill that that you have ascended today is that now as a country and as a sector, we can collect real-time data and use that data to make effective decisions that affect the health of this country. And Your Excellency, again importantly, that now we are going to network facilities into a primary care network using the digital technology that has been provided. We have worked very well with support from my colleague, CS Owalo, who has ensured that infrastructure has been laid in facilities, and we are now on the second layer of ensuring that we operationalize those facilities, Your Excellency. The fourth and last pillar, Your Excellency, is the one on on health financing. We have made a lot of progress. And today, signing of these bills, the Social Health Bill, Your Excellency, as a woman, as a mother, as somebody with health information or who has been in the sector, this is the day that the doctors say that the mother who is pregnant is quickening. We have started now kicking as a ministry because we know that with the social health bill that you have now ascended into law, we are going to move forward, Your Excellency, because there are 3 funds that we have created in there. The primary health care fund to ensure that the primary level is publicly financed. The social health fund, Your Excellency, for many years, and many Kenyans have given us feedback that they were not able to know what is it that they are covered for. Despite paying 500 shillings, they did not know what their benefit is. We have worked with the team, Your Excellency. Now we are clear on what is the benefit as soon as you make your payment. What is it that you are entitled to? Your Excellency, we have removed exclusions. We have removed limitations that now Kenyans will be able to access services and we shall not be able to leave anyone behind. Your Excellency, we are working very hard at the ministry. As the person in charge of the orchestra, I must acknowledge that the team has been working well. There are some strings that need a light touch and they give you the melody that you want. There are some strings that need a heavy touch and still they'll give you the melody that you want. But what you see today, Your Excellency, is a culmination of the efforts of the people at the ministry. And whoever has been on this thing up to midnight was one legal state counsel of the ministry, Terry Rotich. Your Excellency, she guarded these bills as though she was guarding a presidential vote up to midnight. I remember very well, it was 23:45. She sent me and she said, Madam CS, here they are, no comma change, no full stop change. Thank you very much, Terry. Your Excellency, we shall continue to produce the melody that you have asked us to produce to ensure that this country achieves universal health coverage. Today we have laid the foundation stone, and I am sure, I'm persuaded as a Christian, we have laid it on the solid rock. We are going to move, Your Excellency. We have had a very good week in Kapkatet. We have demonstrated to Kenyans that we are ready to go. And today I'm happy that now all our decisions are anchored on a law. We have already started working on the regulations. We are going to involve all stakeholders. And in the next 2 months maximum, Your Excellency, the regulations are going to be ready. Now, with those many remarks, I would like to invite His Excellency, the Deputy President, to make his remarks. Thank you, Your Excellency.